my name is Frederick Olompo. This is my PowerPoint about congestive heart failure, which was the public health issue number 11, where an APRN had asked a group of nursing students to come and provide ongoing health promotion teaching to a group of African American patients with congestive heart failure to help decrease readmission to the hospital. To describe the problem of readmission of African American patients with CHF to the hospital, we have to consider a couple of things. One is that African Americans are more affected by acute heart failure compared with other racial or ethnic groups. And also, we have more risk factors such as high rates of hypertension and diabetes, as well as lower socioeconomic status, higher dietary calorie and salt intake, as well as biologic or genetic differences. The Millennium Development Goals identify cardiovascular disease as a leading cause of death worldwide. Before any teaching or learning can begin, learning assessment needs to be performed. This assessment ensures that optimal learning can occur with least amount of burnout, stress, and anxiety. The learning needs assessment will help review the factors that lead to hospital admissions of these patients. It will also help in learning more about the patient's needs and motivations. Questions that will help with learning needs assessments. Questions about their daily activities, their compliance with medications, diet, exercise, follow-up with regular checkup. The health promotion model suitable to teach this group of patients for me would be the proceed framework of health promotion. This is because this model aims to empower individuals and communities to understand and engage in efforts to improve their quality of life. We find that most readmissions for CHF due to preventable causes such as non-compliance with medications, poor dietary habits, stress, and lack of follow-up visits. So this model fits this group because the interventions for them will be for them actually just to teach them and empower them through planning and education. So when they perform the activities themselves, they will minimize the chances of them coming back to the hospital. A goal that can be identified for these patients during the health education planning stage will be, for example, for them to be able to understand some lifetime modifications. These modifications could be quitting and smoking, losing or maintaining weight, avoiding alcohol, eating a high-fatty diet, or exercising. An objective for them will be for them to be able to state three lifestyle modifications, for them to be able to state the significance of the medications that they mentioned. In other words, they're going to be able to understand why they have to give up some things. And the third objective will be for them to be able to outline how they are going to be able to carry out the lifestyle modifications. Research has identified African Americans as the most likely group to be readmitted for CHF due to factors such as low socioeconomic status or high rates of hypertension or inadequate access to healthcare. Most of the articles that I found aim to create awareness about the importance of performing a complete assessment to identify patients that are at risk so that plans can be made for their needs to be met before they discharge. Also, some articles do highlight the importance of providing adequate medication to at-risk patients during their hospital stay. Evaluation is important in any teaching process because it verifies whether or not learning is required. Nurses should get immediate feedback from patients to assess whether more education is needed. In this case, in trying to evaluate patients, you can try and make sure that they can successfully stay good lifestyle modifications. Also, that they understand the impact of the lifestyle modification to their health. And also, that the patient can stay viable ways of carrying out lifestyle modifications. In conclusion, we've learned that hospital readmissions often lead to increased healthcare costs due to extended hospital stays that can be prevented. Patients at risk of readmission should be identified on admission after a careful assessment of risk factors that may lead to their readmission. And an individualized care plan should be designed to meet the learning and self-care needs of the patient throughout the hospital stay. Also, we should encourage follow-up with the primary care provider so that they are able to care for themselves before outside of the hospital. And this is my last slide. Thank you for listening. Take care.